Management of long haul COVID and integrative medicine perspective. So, this is a re recording of the grand rounds that was given to medical colleagues on June 15th, 2021. We had some technical issues. I'm Gina Serraiocco, board certified in internal medicine and integrative medicine, presenting a perspective today based on the information that we have. We do have integrative medicine at the Palo Alto Medical Foundation. My colleagues are listed here on the right. We are all dual boarded with also additional functional medicine training. And in a nutshell, I call it optimizing the macro, lifestyle, mindset, and environment, and the micro, nutrients, gut microbiome, cellular energy, epigenetic, genetics, toxins, to support innate healing. And you'll see the essence of that today in this talk. The referral is in EPIC, Integrative Medicine San Carlos. Everything that I talk about today is also presented in my shared medical appointment for long COVID, and that's also at our system here. It's two 90-minute sessions for any patient who feels they have long COVID, regardless of positive test. So here's the challenge. This challenge of this thing with many names: long haul COVID, long COVID, post-COVID syndrome, post-acute sequelae of SARS-CoV-2 infection. This happens in about 10% of even mild to moderate COVID cases, with symptoms lingering beyond 8 weeks. 50% of patients with long haul COVID never had a positive test. Either the tests weren't available or they got tested too late. And Congress has dedicated $1.5 billion for NIH research. What is it really? Is it persistent virus or viral fragments causing inflammation? Is it autoantibodies? Is it reactivation of old viral disease? Could there be epigenetic changes from the spike protein, endothelial and vascular inflammation, and organ damage? It kind of looks like this, right? It reminds me of the story of 6 blind men describing an elephant. Everybody's right. And I do think that with time, we'll all come together and figure it out. But until then, here's my perspective. This is all we can go on, right? Because we're still waiting for those double-blinded, randomized controlled clinical trials for treatment. But until then, many patients are suffering. And I do think that there are some ways that we can alleviate that suffering. So this is what I know. It's based off of clinical experience from treating over 100 post-COVID patients, personal experience from treating mysterious post-infectious illness over the past 5 years. And what you'll see here is that while long-haul COVID is new, post-viral infections are not new. We've known about them for a long time, and fortunately, we've learned from people who have healed. This is also reflecting shared experience from colleagues and also the limited and evolving research. So to orient us in terms of integrative medicine, we're also just going to think about the terrain. A healthy terrain, healthy tree. Healthy terrain, healthy body, right? The terrain is listed at the bottom in the soil, the sleep, relaxation, exercise, healthy diet, the mindset, genetics. So what happened during the pandemic? Wow, we found that our whole terrain actually got a lot more inflamed. So people weren't sleeping as well. There was a lot more video time. Blue light from the screens affects our melatonin production. The gyms were closed. People were afraid to go outside. Inflammatory diet, right? The supermarkets were sold out of things like sugary cereals and ramen and all the packaged foods. Lots of stress and fear and trauma and threat, and people were worried about their blood type. An inflamed terrain triggered by a COVID-19 infection caused a chaotic body. So here we have listed some of the most common symptoms that we see in long haul COVID: cough, shortness of breath, post-exertional malaise, fatigue, horrible brain fog, chest pain, headache, you name it, it's there. What we're going to focus on today is the trunk. What about the terrain is transmitted through the systems, the trunk, that then expresses in the outward part of our organs? And we'll be looking at that today. Let's lead with a patient story. 35-year-old female, previous life coach and fitness instructor, super healthy. April 2020, felt a little under the weather, lost her smell, got a positive COVID test. She really didn't think much of it. But over the next month, she developed overwhelming fatigue, brain fog, myalgias, erratic heart rate, blood pressure, shortness of breath. She actually went to the emergency room twice due to anxiety and chest pain. She just thought she was dying. Nausea and diarrhea coming and going, and extreme exhaustion after any activity, even taking a shower, and non-restorative sleep. She's been on disability for the last 10 months, and she says, "Doc, nothing is helping. I look okay, but I'm not okay." So what if we take her symptoms and put them into a construct of something that we kind of understand from an integrative medicine perspective? And I'll be talking about some of these things: mast cell activation syndrome, dysautonomia, chronic fatigue syndrome. But essentially, all of these symptoms are um, are recognizable from an integrative medicine perspective. So the main ones are in the middle here: fatigue, brain fog, headache and migraine, myalgia, GI symptoms. These are all overlapping, but mast cell activation syndrome, which we'll talk about, symptoms tend to come and go: a little bit more chest pain and the itchy, sneezy hives. On the right, under dysautonomia, the distinguishing features tend to be anxiety and this erratic heart rate and blood pressure issue. And then at the bottom, chronic fatigue syndrome, the distinguishing symptoms tend to be this post-exertional malaise and non-refreshing sleep. So even though we see all of these in long haul COVID, we can sort of group them into syndromes that we've seen before, and we kind of know how to help, or at least we think we do. So this is a preprint paper that just came out this June from the Mayo Clinic. And what they looked at was long haul COVID patients and their IL-6 levels. IL-6 is a type of inflammatory cytokine. So what they found is that when patients presented mainly with chest pain and short of breath, they were mostly male and lower IL-6 levels. But if patients presented with fatigue, myalgias and muscle aches and orthostasis, 84% of them are female with a higher IL-6 level, so higher cytokine inflammation. And they have this central sensitization, which we'll talk about later. So this starts to give us an idea of different types of presentations in long haul COVID. So always in integrative medicine, we're going to look at the roots. We're going to look at the terrain and then how they affect the systems to result in the symptoms, okay? So there are over 10,000 studies in the PubMed database explaining why a whole foods, plant-based diet on the left is just the healthiest diet for the body and the immune system in general, as opposed to the standard Western diet. But what is little known actually is that food changes our genes. Food changes the way our immune system reacts. And that's shown in this fascinating study out of Cell in 2018, where we see, just in this picture at the left, on a healthy diet, this body inflammation is low. And the bone marrow cells, the precursor bone marrow cells, are not overreactive. They're beautifully calm. On a Western diet with ice cream and hot dogs, the NLRP3 inflammasome, which is sort of like the master switch for inflammation in the body, activates, and there's a ton of inflammation. So we see the inflammation is high. But we also see then that the precursor bone marrow cells also become hyperreactive. So unhealthy food caused inflammation. That inflammation changes our bone marrow genetics to result in being hyperinflammatory. What's also interesting is if you go from a Western diet to a healthy diet, that switch alone actually does decrease the body inflammation pretty quickly. But unfortunately, look at this. The bone marrow precursor cells for our immune system stay hyperreactive. They're going to overreact. In this same study, what we were able to see is that when these animals were subjected to a Western diet and then given a trigger called lipopolysaccharide, LPS. This is a endotoxin from bacteria in the gut. We see that on a Western diet, there is much more reactivity. You see the IL-6 here levels way higher than on a normal healthy chow diet. We also see that on a Western diet, look at all the different genes that are upregulated, much more inflammatory reaction than on a healthy diet. So the bottom line here is that a healthy diet is important, but a healthy diet alone may not be enough to mitigate a chaotic immune response. We've got to reduce the triggers to immune cell reactivity, especially when ill. So you'll hear me talking a lot about reducing triggers today. So, what is mast cell activation? So we talk about the root, nutrition. Let's talk about a system that has a lot to do with that as well. So the mast cell, if you'll remember, it comes from the common myeloid progenitor cell in our bone marrow. That forms a lot of the immune system cells that are part of our defense, and the mast cell is here on the left. The mast cells are the first line of defense where the outside meets the inside: skin, respiratory epithelium, gut lining, and in the connective tissue around the blood vessels, smooth muscles, hair follicles. And the mast cells release histamine and leukotrienes, and actually a lot of other things. So, what happens in mast cell activation syndrome? Well, I heard someone describe it kind of like central dispatch calling the SWAT team for a coffee spill at Starbucks. So, way too much attention for just a little problem. And what happens then? Well, first of all, do we have evidence that mast cells are involved in COVID? Yes, we do. This is one of several studies now in frontier immunology showing that there is indeed mast cell activation in COVID-19, and we can prove that with mast cell specific proteases that are indeed positive. So mast cells are part of the problem. And here we have a paper from Larry Afrin and team showing all the different symptoms that are common in mast cell activation. Take a look here: fatigue, fevers, headaches, chest pain, shortness of breath, bloating. Sounds really familiar, right? And so, interestingly, if you look at the words in bold, these are the ones that overlap with post-COVID syndrome. There's tremendous overlap between a typical mast cell activation patient and a post-COVID patient. Well, it's kind of good news because we know what to do with mast cell activation, at least in integrative medicine. So, how do we distinguish mast cell activation from some of those other syndromes I showed you on one of the earlier slides? How do we distinguish it from dysautonomia or chronic fatigue? I tend to see the symptoms that come and go drastically. So, depending on triggers. So, particularly the GI symptoms, the bloating, the vomiting, the heartburn, the chest pain. If someone says, well, I ate tomatoes one day, it was fine, and the next day it just caused me all these issues, I think about mast cell activation. So a lot of different things can trigger mast cell activation, right? We got to try to keep the mast cells calm. Stress is a main one. So this is way back from 1995. Theoharides published and noted that stress caused degranulation in 70% of rat dura mast cells within 30 minutes. And complete inhibition was achieved by pre-treating the animals with polyclonal antiserum to CRH. So basically, this proves that stress triggers mast cell release in some people. Other triggers that are common, well, any form of stress: anxiety, pain, temperature changes, exercise, infections, drugs, food, insect bites, chemicals, and smells. In fact, a lot of doctors have seen patients who seem to be allergic to 20 different medications. They probably have some mast cell activation. I actually had a patient who had a mast cell trigger every time his neighbor did the laundry. So the chemicals from the laundry set him into a flare every single time. So mast cells are a huge part of the symptomatology of a long haul COVID patient. So what can we do about that? Well, a low histamine diet. Now, we don't have any specific trials of a low histamine diet published in post COVID, but we do have some trials in mast cell activation syndromes. And this one here is for chronic headaches. So, what they basically show, this was in clinical and experimental allergy, was that they had patients do a very simple histamine free diet: no fish, cheese, hard cured sausages, pickled cabbage, and alcohol beverages for 4 weeks. And what they found in these chronic headache patients is that 33 out of 45 patients improved considerably, and 8 of them had complete remission of their chronic headaches just by avoiding these foods. In the Annals of Dermatology, a histamine-free diet is helpful for adult patients with chronic urticaria. Remember, urticaria is caused by histamine, among other things. So these patients were given a little bit more of a complex and thorough low histamine elimination. You'll see things listed here: fish, pork, chicken, spinach, fermented foods, some yogurt, some ketchup, instant foods, and select fruits and chocolate, unfortunately. So their conclusion was that a histamine-free diet is helpful for the treatment of adult patients with chronic urticaria. And in the chart here, you see that the patients had significant improvement, not only in the number of medications they use, but also in their quality of life. They were able to sleep better and have a better social life. So at least we have some basis for suggesting a low histamine diet in patients who may be looking mast cell-ish. Now, before I go into supplements, one thing that I want to talk about is a resource at Sutter called the Natural Medicines Database, because we're not taught a lot about supplements. So the Natural Medicines Database is kind of like up to date for supplements, and we've all got access to that. Also, let's talk about supplement safety. So supplements are not regulated by the FDA. So we do know that we have to be extra careful in the supplements that we look at and recommend. Fortunately, there are a few good third-party testing sources. So in general, you want to look for a supplement that was approved either by consumerlab.com, USP, or NSF. It's not that easy to find these, but if you look, you can. Consumer Lab is a fee-for-service website that not only gives you names and brands and quality, but also gives you a lot of research as well. And I use it probably daily. The other thing about supplements is they are like drugs, so I treat them like drugs. I ask myself, is it likely to be helpful? Is there evidence? What's the safety? What are the drug interactions and side effects? Can I get a lot of bang for my buck for one supplement? And can we use it for the minimal time needed? So I think it's important to look at these like drugs and not just to pile them on and keep them on. So I'm going to use luteolin as the first supplement that I'm going to talk about today. And just to give you an idea of my rationale, we're not going to have time to talk about tons of supplements, but this is the idea of how I think about supplements. So luteolin is a plant flavonoid. It is a mast cell stabilizer. So in this study that was published actually earlier this year, March, one of the things we see from, again, Dr. Theo Theoharides is that luteolin is actually quite a potent mast cell stabilizer. So look on the x-axis here. When the mast cells are stimulated with substance P, and on the y-axis, we see histamine release levels. We see that in a dose-dependent manner, mast cells that are incubated with luteolin actually decrease histamine release much better than cromolyn, which is a prescription mast cell stabilizer. Well, we want to pick supplements that do not just one thing, but multiple things. So luteolin also reduces IL-6. Remember, IL-6 levels are elevated in 84% of the females who present with fatigue and myalgias and orthostasis. So this study from PNAS in 2008, luteolin reduces IL-6 production in the microglia. Now, why is this important? It's important because the microglial cells in the brain are triggered and cause inflammation, and that can contribute to brain fog. So what we see here in this study is that when mast cells are incubated with luteolin and then subjected to that lipopolysaccharide, that gut endotoxin, in a dose-dependent manner, we see that there is a decrease in IL-6 release. So look at how potent luteolin is in decreasing IL-6 inflammatory cytokine in the brain cells. Hugely important here. We also have many studies on luteolin and its antiviral abilities. It's been studied in EBV, dengue, flu, etc. And what about possibility being protective in long haul COVID? And this is important because some people theorize that there's a low grade amount of COVID-19 still active in long COVID patients. So multiple molecular docking studies have been done on luteolin against the main protease targets of the SARS coronavirus 2. And what we see here is that luteolin has tremendously good binding potential to the main replicating parts of SARS-CoV-2. So at least there's theory that it might be antiviral, not just in the viruses above, but also in SARS-CoV-2. More data needed, of course. So of course, whenever we think about supplements, we also wonder about side effects. For every 100 papers on luteolin stating its beneficial effects, I did find one paper concerned about endocrine disruption. Even though it's very safe in animal studies, luteolin may have some progesterone antagonist activity. I have not seen this be an issue in my patients, but nevertheless, I don't recommend it for pregnant women. And in general, supplements in pregnant women need to be used with caution. I only use it for the shortest amount of time needed, generally 3 to 6 months. And of course, food first. So luteolin is very high in a lot of the spices, oregano, parsley, thyme, sage, peppers, and celery. So more reasons to include that in your food just on a daily basis. I'll just make a side note on vitamin D. There are about 20 studies on vitamin D and its benefit on the immune system in COVID-19. One of the reasons may be this, that vitamin D contributes to mast cell stabilization. In fact, vitamin D is required to maintain the stability of mast cells. So this is why I always check vitamin D levels in my patient, and I try to make sure they're over 30. About 80% of my patients have a level less than 25, which is deficient. Okay, so an integrative approach to mast cell activation. So any patient with post-COVID, if their symptoms kind of come and go, particularly with GI, I think there is a very good rationale to try this approach. First, let's eliminate stress if we can. Let's try a low histamine diet. At the end of this talk, I will give you a link to some resources that we give to patients. So a low histamine diet is 3 parts. Avoid high histamine foods, things like alcohol, smoked meats, aged cheeses. Part 2 is avoid histamine liberating foods like tomatoes, walnuts, and shellfish. And then avoid foods that block diamine oxidase enzyme. This is the enzyme in the gut that helps to break down histamine. So we don't want to block that. Alcohol and black tea can block that. So this charcuterie platter on the bottom right-hand corner here is definitely a no-no on the histamine diet, the low histamine diet. In addition to that, we talked about how powerful luteolin is at decreasing the histamine release in mast cells. So I do have a supplement I like that's a combination of luteolin and quercetin. Again, it's a mast cell stabilizer. It decreases IL-6 as an antioxidant. It protects the brain and the microglia. It's also antiviral, so lots of bang for your buck. And I've had patients try this in post-COVID, and they tell me specifically that within a week of taking this, that their brain fog got better. Diamine oxidase enzyme capsules can be used. So if someone's going to be eating a higher histamine meal and they can't help it, they can take some diamine oxidase enzymes at the same time as the meal to try to mitigate that histamine response. Let's give vitamin D and adjust to keep levels above 30. Lots of other things we don't have time to talk about today, but green tea, chamomile tea, resveratrol, vitamin C, turmeric, all important in managing mast cells in mast cell activation and probably post-COVID as well. Now, this may seem surprising, but even in integrative medicine, yes, we're going to use drugs. So very, very important and potent part of symptom control in post-COVID is going to be antihistamines. Histamine 1 and histamine 2 blockers, and maybe even a prescription called Singular. Now, histamine 1, these are the common allergy medicines: loratadine, Claritin, fexofenadine, Allegra, cetirizine, Zyrtec, and the histamine 2 blockers, famotidine, which is Pepcid. Tips from experience: patients often need twice the normal dose. So if the box says take once a day, you may need to take it twice a day. So my average patient uses, say, loratadine 10 milligrams twice a day plus famotidine 20 milligrams twice a day. It's important to also try multiple formulations. Failure of one doesn't mean failure of another. So rotate through the different antihistamines to find the best effect. Benzodiazepines, these are generally relaxant medications. are actually very helpful in mast cell activations who have profound anxiety. They're just going nuts. They are just going out of their skin. They cannot sleep. Benzodiazepines like clonazepam are actually mast cell inhibitors. So I will use these selectively in my responsible patients since they do have a habit forming quality, although none of my mast cell activation patients ever abuse the benzodiazepines. And then our allergy colleagues have a lot of extra tricks up their sleeves. So definitely a referral, and they may consider prescription medicines like cromolyn, ketotifen, Xolair, steroids, etc. So that kind of summarizes what I think about in terms of an integrative approach to mast cell activation syndrome, and most likely in post-COVID, because in my experience, this has been greatly, greatly helpful for those post-COVID patients who have that GI symptoms that come and go quite a bit. So you may want to have everyone try this for 4 weeks and see if it helps them. Now, speaking of GI dysfunction is a huge part of post-COVID. We know that over 50% of post-COVID patients have GI symptoms. And what's really interesting is that fecal PCR for SARS coronavirus 2 is positive for more than 4 weeks after the nasal swab turns negative. So we've got viral activity going on in the gut. This study just came out in April. Gut microbiota composition reflects disease severity and dysfunctional immune responses in patients with COVID-19. And these authors concluded that the gut microbiota dysbiosis after disease resolution could contribute to persistent symptoms, which basically means we got to pay attention and get good bacteria back into the gut. This was a particularly interesting study coming out of Harvard by Alessio Fasano's group. The multi-system inflammatory syndrome that we see in children is driven by zonulin-dependent loss of gut mucosal barrier. What does that mean? So zonulin is a protein that regulates the tight junction. So this is the gut mucosa. Usually is nice and tight. Nothing should be passing through that isn't specifically selected to pass through. But zonulin gets released, triggers a loss of the tight junction, and allows the SARS coronavirus 2 spike to get through into the bloodstream. And this triggers a huge downstream inflammatory response. So why is that important? Well, turns out this leaky gut that happens is responsible for much more than just COVID getting into the body. So this is a very nice review article that was done in Frontiers in Immunology just this April. And basically what it reminds us of is that a normal gut should have really good tight junctions. But when we start to get bad bacteria, like a Western diet, and then an infection, what we see that we get loss of the tight junctions and we start to get a loosey-goosey barrier here. Stuff starts to pass through, including bad bacteria, including the spike protein possibly. And then we see a trigger that goes into autoantigen mimic inflammation and then autoimmunity. So this is actually quite well established that a leaky gut and bad bacteria increases autoimmunity risk. This is a huge problem. In addition to that, remember the lipopolysaccharide that I've mentioned a couple times. Lipopolysaccharide is derived from the bad gut bacteria. That lipopolysaccharide now can enter through a leaky gut, trigger more domino effect of inflammation. And here's a study showing that systemic lipopolysaccharide causes chronic neuroinflammation, i.e., potentially the brain fog in long COVID patients. So what can we try? I mean, what can we try while we're waiting for the research, right? Well, oftentimes we'll talk about a gluten-free diet and probiotics. And just briefly, this really great study in the Scandinavian Journal of Gastroenterology. Gliadin, so gliadin is a protein found in gluten. Gluten is in wheat, barley, and rye. So gliadin, zonulin, and gut permeability. And they looked at the effects of gliadin, not just in celiac patients, but also in normal patients as well. And what they found is based on our results, we concluded that gliadin activates zonulin signaling, so leaky gut, irrespective of genetic expression of autoimmunity, leading to increased intestinal permeability to macromolecules. This is a huge problem. This is saying that regardless, celiac or normal person, gliadin, gluten, wheat, barley, and rye, can increase the chances of leaky gut, okay? What about probiotics? Well, this was just one study that was done. We're giving probiotics to patients before surgery. And what they found was that this decreased post-operative infections, septicemia, and is associated with reduced serum zonulin concentrations. So at least proof of concept that probiotics and a gluten-free diet may decrease the intestinal permeability, or at least maybe help treat it in what's going on in post-COVID patients. So an integrative approach, at least the very basics, the very starters to healing the gut in post-COVID. Number 1 and 2 and 3, decrease stress. Stress is a cause of intestinal permeability. And then whole foods, plant-based diet. These are healthy vegetables that help to reestablish the healthy gut microbiome, the healthy gut bacteria, and decrease inflammation in the gut. We talked about a low histamine trial already, and then I certainly layer on gluten-free and a probiotic. Fermented foods are actually very limited on a low histamine diet, which is why probiotic pills actually become helpful. So these are meant to be temporary. Okay, I'm not recommending gluten-free for life. Most of these patients will be able to go back to a normal diet once they are healed. All right, just a little side note here on the loss of smell in a lot of post-COVID patients. This is hugely, hugely frustrating because there's not a great answer. We have patients try smell therapy for 4 months, which is choosing a few different fragrances, sniffing them for 20 seconds twice a day, and really thinking about the connection between that fragrance and all the thoughts that they recall about it. The numbers are not good. Maybe 23% of patients will get better. But if you add in intranasal vitamin A, so 1 drop each of intranasal vitamin A for 8 weeks, the recovery rate bumps up to 37%. So still not great, but better than nothing. And again, the website that I have at the end will give some information about this. All right, so we've talked about various root systems so far, the nutrition. Now let's go on to exercise. Now, this is going to be different than what you think, right? Normally, we say everyone just needs to exercise. However, in post-COVID, it's really important to ask patients, what happens if you try to exercise? If they say they feel awesome and they like it, yay, great, exercise to your heart's content. However, if they say anything akin to post-exertional malaise, this is worsening of symptoms following even minor physical or mental exertion, often lasting for days or even weeks, then we have to give different advice. So my patients will say things like, a trip to Costco just wiped me out for 2 days. Or I thought a walk around the block was going to be okay, but then I was in bed for the next 48 hours. So I think it's important to listen to patients. And in these patients, do not push the exercise. Instead, we're going to have them self-pace during their improvement process. And I'll explain that in a moment. So let's talk a little bit about the system that sort of matches with the exercise, this chronic fatigue syndrome. Okay, so here on the right, this picture shows all the different symptoms that are commonly seen in chronic fatigue syndrome. Now you'll see a lot of these sound like post-COVID, right? Mood issues, brain fog, feverish, cardiovascular issues, fatigue, GI issues, right? Lots of overlap. So how does this distinguish from mast cell activation and dysautonomia? From my perspective, 2 main things. If a patient says they have unrefreshing sleep, doc, I took my hot shower, I did my meditation, I turned off the news, I got my 8 hours, but I still wake up feeling like I was run over by a truck. Chronic fatigue syndrome. Post-exertional malaise. Doc, I took a shower and then I just had to recover for the next 8 hours. Post-exertional malaise. So these 2 things kind of distinguish from mast cell activation and dysautonomia. So what might that tell us and inform us about treatment options? I'm going to take us way back to medical school and maybe even high school. We're going to talk about the mitochondria. So here, this little picture down at the bottom is an average cell. You see these little pink blobs here. These are the mitochondria, and you might remember them as the powerhouse of the cell. So remember, our human bodies rely on power packets called ATP. The body makes its body weight in ATP every day, and the body cannot store ATP. So if you're not making ATP, you're literally out of gas. So you can imagine if your mitochondria is dysfunctional in any way, 10% or 20% dysfunctional, you're making less ATP, you're making less fuel for your body, thus you have less energy, okay? And so is mitochondrial dysfunction a problem in COVID? Well, yes. So this was published in January. We see evidence of mitochondrial manipulation by the SARS-CoV-2 virus. And in particular, we see the reserve capacity of the mitochondria is drastically low in a COVID-19 infection as compared to a normal person or a person with a regular chest infection. So specifically, the mitochondria are just thrashed in a COVID-19 infection. Here on the y-axis, they're using OCR. OCR is short for oxygen consumption rate. This is a measurement of mitochondrial respiration. So the bottom line is the mitochondrial function is significantly impacted in COVID-19. So what can we do to help the mitochondria? Well, first, let's try to stop as much of the infection and inflammation and stress as possible. Certain drugs can contribute, as can certain toxins. What can we do to help the mitochondria? We're mainly going to focus on nutrients that are going to support the process of making ATP, but also protect the mitochondria from oxidative stress. Please note that there are many other ways to really boost mitochondria in a normal person. So you'll see them here: intermittent fasting, high intensity interval exercise, and cold plunges. However, these last three probably are not super applicable to the average post-COVID patient. So we're going to focus on the mitochondrial nutrients. Now, this next slide is a little bit busy. Let me break it down for you. So this middle section here is the electron transport chain. This is the main part of the energy factory within each mitochondria. Now take a look here. So this is the mitochondrial factory. Look at all the different colors. The colors are the nutrients that have been proven to be necessary in order for the electron transport chain to work. We see our B vitamins, tons of B vitamins that are needed. We see selenium, we see coenzyme Q10 in multiple spots. Melatonin is really important for mitochondrial function. Nitrates, vitamin E. So if somebody is deficient in nutrients, not eating well because they don't have energy to get out of bed and feed themselves, this becomes a compounding problem. In addition to these nutrients that are needed to run the electron transport chain, we also need antioxidants such as alpha-lipoic acid, N-acetylcysteine, and resveratrol. These each have independent data showing that they boost mitochondrial activity and protect them from oxidative stress and inflammation. So do we have any evidence that giving sick people mitochondrial nutrients actually helps them? Well, not a ton of evidence. I dug this out from 2012 International Journal of Clinical Medicine. Basically, they gave them a mitochondrial cocktail, and they gave it to these intractable chronic fatigue patients and Lyme disease patients. And what they basically found is that when they gave them this mitochondrial support cocktail with a lot of the nutrients that I talked about earlier, there was a 30% reduction in overall fatigue. This is huge. These are patients that could barely get out of bed. So a mitochondrial nutrient supplement was able to reduce their symptoms by about 30%. I'm going to take that data. This one was actually in Cell Metabolism, just published last year. Niacin, which is B3, niacin cures systemic NAD deficiency and improves muscle performance in adult onset mitochondrial myopathy. So these are primary mitochondrial myopathies. These weren't caused by illness, but at least it's proof of concept that if we give the patient the right nutrient, that it can then help boost NAD, which is part of the whole electron transport chain, in order to improve mitochondrial function and muscle strength. So Wrapping up with the integrative approach to the mitochondrial dysfunction, when someone has fatigue and it's sort of suggestive of chronic fatigue, that element of post-COVID, number one, if there's post-exertional malaise, do not push the exercise. Instead, empower the patient with something called self-pacing and the spoon theory of energy management. So again, on that website I give you at the end, there's going to be some links to inform a patient how to self-pace. One of the theories that patients find really helpful is called the spoon theory. So when you wake up in the morning, you think of yourself as having just maybe 7 spoons of energy. And you've got to assign those 7 spoons of energy. Maybe 1 spoon is for a shower, maybe 3 spoons are to feed yourself for the day, and then the other 2 spoons are to, or 2 or 3 spoons are to go to a doctor's visit. After that, you're out of spoons. Don't overbook yourself. These patients will flare and then will backslide for several days and then try to make up for it. So it's really important to know your limits and to know that those limits will start to get better as you heal. So a whole foods plant-based diet, reduce stress and inflammation, and then a mitochondrial support supplement can be beneficial. And this support supplement should include your Bs, your alpha-lipoic acid, acetyl L-carnitine, NAC, resveratrol, CoQ10, niacin, melatonin. Alpha-lipoic acid probably has the most data in terms of mitochondrial function and nerve function. So if somebody doesn't want to take a multivitamin with everything in it, alpha-lipoic acid can be helpful. Again, I'll give you a link to a specific supplement at the end. Since this is a continuing medical education talk, I can't talk specifics. Okay, what about endothelial function? This is another system that connects the whole body. The European Heart Journal boldly proclaimed last year that COVID-19 is, in the end, an endothelial disease. And the graph here, this picture reminds us that when there's a viral infection, it triggers inflammation. We see IL-6 here again. And that domino effect leads to blood clotting and impaired fibrinolysis. So there's a lot of things happening here. In fact, the average patient being discharged from the hospital is also being given a statin drug to help to mitigate this process. Well, there's plenty of data that a whole foods plant-based diet is the best way to decrease inflammation and promote healing in endovascular disease, not necessarily with post-COVID because we don't have that research, but in other types of blood clotting vascular disease. And I'm going to make the case for adding omega-3 fish oil. There's plenty of data of omega-3 fish oil in cardiovascular health, but we don't often think about it in terms of resolving inflammation. And there's some theory that in post-COVID syndrome, we just have ongoing simmering inflammation that isn't able to just get resolved. So this was published in Nature. Pro-resolving lipid mediators are leads for resolution physiology. We want to resolve the infection. So what we see here is the blood vessel. We get hit by the SARS coronavirus 2 that causes a lot of vascular response that leads to the acute inflammation. Okay, that domino effect of acute inflammation, once it's done, we think and hope that it should resolve, right? We should re-achieve balance. The immune cells should rebalance. We should kind of clear out the junk and go home. However, many patients have chronic inflammation, which leads to organ fibrosis. And one of the key differences that controls the switch point is here, omega-3 polyunsaturated fatty acids. Omega-3s are the backbones for SPMs. SPMs are special pro-resolving mediators called resolvins, protectants, and merisins. Without omega-3s, you cannot achieve homeostasis. You cannot resolve an inflammation. So I'm going to be talking about omega-3s as one of my main supplements that I do recommend for patients who aren't eating at least 2 to 3 servings of wild-caught salmon or other high-fatty fish per week. Now, before moving on from endothelial disease, I just can't go on without just a side note about statins and coenzyme Q10. Statin medications are cholesterol medications that block the formation of cholesterol, and they do that by blocking an enzyme called HMG CoA reductase. It beautifully blocks cholesterol. However, if you take a look to the left, an unintended consequence is that it blocks coenzyme Q10 production as well. Remember that I said in the electron transport chain in the mitochondria, you cannot make energy without coenzyme Q10. So it's kind of a problem that is being blocked by statins. And this gives you an idea. So here at Sutter, we do have a regular test that we can order as a fasting test for coenzyme Q10. This is what my average patient on a statin looks like if they're not on a supplement. Their numbers are really, really low. Now, this gentleman was low for 4 years because he was a doctor himself and did not believe in supplements until he started coming in really weak and his muscles were weak and he came in a walker. And I said, hey, your way's not working. Let's do my way. So I did put him on some mitochondrial support and high doses of CoQ10. You'll see his levels came up nicely within a few months. And a few months after that, he was able to ditch his walker and his muscles felt much better. So just keep that in mind if your patient is on a statin. CoQ10 supplement is strongly recommended in my perspective. All right, so we talked about nutrition, we talked about exercise, let's talk about sleep. I'm not going to belabor this too much. We know that probably the main tip here is to make sure to rule out sleep apnea. Uncontrolled and undetected sleep apnea is just a silly thing to miss. So rule out sleep apnea. Of course, we promote cognitive behavioral therapy for insomnia, which is the #1 treatment above medications. We got to recognize that blue light. So in our environment, our lights, our videos, blue light blocks melatonin production. So if somebody is blocking their melatonin production, they are melatonin deficient. And for many people, melatonin can be actually helpful, not only for their sleep, but remember, melatonin is needed for mitochondrial function. There's also plenty of data on melatonin actually being important for healing intestinal permeability as well. So it is not just a sleeping supplement at all. And it is one of the important ones that I do recommend for people who are healing. Of course, meditation, avoid the negative news at night. My next favorite supplement for sleep is actually called magnesium glycinate. Magnesium glycinate. 400 milligrams at night. This is perfectly safe as long as there's normal kidney function. Magnesium itself has data on decreasing stress, anxiety, helping with sleep, myalgias, fatigue, cramping in the leg, chronic headaches, palpitations. All of these symptoms we can see in post-COVID. So I have a very low threshold for recommending magnesium glycinate. Really, the only limitation here is just the number of supplements people start to take. And then if a drug is needed, I always start with a first generation antihistamine because it might help with their mast cell as well. So Benadryl or hydroxyzine, which is Adirach's prescription. I don't normally recommend these medications long-term in normal people, but in post-COVID, they may be helpful. And if somebody is just having out of control anxiety with mast cell overlay, it is true that clonazepam may be helpful while the rest of their body is healing. All right, let's go on to the next route, right? We talked about sleep, we talked about exercise, talked about diet. But what about the mindset, right? Everyone tipped over into stress and fear and trauma and threat. If there was a master switch that could affect all of these systems at the same time, what might that be? What might be the thought that triggers the behavior of all of these systems at the same time? And I'm going to propose that it's the I'm not safe thought, right? The entire pandemic was I'm not safe. When the brain says I'm not safe, it changes the behavior of all of the systems we just talked about, the immune system, the peripheral nervous system, the mitochondrial system, vascular system, GI system. When the brain feels not safe, all of the systems switch into I am not safe mode. So this to me is the key part that is missing from most of the long haul COVID discussion. So as an example, let's talk about one of the systems that goes chaotic, dysautonomia, dysfunction of the autonomic nervous system. So take a look at all the different symptoms. This is by the Cleveland Clinic. Again, a lot of these look familiar, right? Post-COVID patients have all of these: gut issues, dizziness, shortness of breath. So what are the symptoms that kind of distinguish this from the mast cell activation and the chronic fatigue? In my mind, it's the large swings in heart rate and blood pressure. People literally feel like they're dying, they're panicking. I got to go to the ER, I'm dying, something's wrong. Heart rate up and down, blood pressure run up and down, body temperature up and down. Think dysautonomia. And to be frank, I've treated this for the last 5 years, and my patients who heal from this all undergo brain retraining, switching from I'm not safe to I am safe. And we'll talk about that in a moment. Other thing that might help mitigate the symptoms, definitely salt loading every morning can be helpful for these patients and their blood pressure. Compression stockings, avoiding heat. And our cardiology colleagues have a lot of tricks up their sleeves as well. So some medications may be warranted here. However, brain retraining is key. We got to switch from threat to safety so that all the systems change. The brain is almost like a puppet master that is changing the signals and the behavior of the rest of the body. Now, this is not a new theory. In fact, Ashok Gupta put this into a visual. So let's just go through this for a moment. We have the brain in the middle, in particular, the amygdala, the insula, the hippocampus. This is the part of the brain that kind of assesses and puts an emotion around a specific situation. So take an average person who had predisposing factors. Maybe they're genetically wired to be anxious. Maybe they had some childhood trauma. Maybe they were already stressed because they lost their job. And then you throw on an acute psychological stress, say a global pandemic. And then the thing that knocks the dominoes over is a viral infection, say COVID-19. That then puts the brain into a state of, oh, I'm not safe. When there is this I'm not safe mode, we get this chronic sympathetic nervous system arousal that starts to signal to the rest of the symptoms, immune dysfunction, hormone dysfunction, oxidative stress. A lot of these systems we already talked about with the mitochondria, the brain inflammation, the nervous system, that starts to cause the symptoms, muscle dysfunction, cognitive difficulties, all the leaves in our tree. And what happens between 6 and 8 here is that patients start to have a feed forward cycle. I hurt, I'm not safe. I'm in pain, I'm not safe. Is this ever going to get better? I'm not safe. So there's basically this vicious cycle of I'm not safe happening. And that we think is at the base of a lot of patients who have this central sensitization happening. But the good news is that we may be able to help these patients. Just a reminder that neurons that fire together wire together, right? So if we're constantly in the I'm not safe mode, those neurons are going to get stronger and stronger. We're going to try to reset that. So what I tell my patients is your symptoms are in the body, but the answers are not in the body. They are in the brain, and you can rewire that. So that's a pretty big statement. Do we have any data to show that we can rewire this loop? Well, until recently, no. Until recently, this was entirely based off of clinical experience, and I have very good clinical experience. Thousands of integrative doctors have had very good clinical experience, but thank goodness we actually have the first randomized trial, and it was quite well done. So in the Journal of Clinical Medicine, just in October, mindfulness-based program plus amygdala and insula retraining in fibromyalgia. It's a pilot randomized controlled trial. Now, I will point out here that there were 2 groups. The control group got taught relaxation therapy for 8 weeks. And this was quite intense. So 2 hours a week for 8 weeks, they got taught different kinds of relaxation, visualizations, autogenic relaxation, progressive relaxation, breathing. So there's quite a bit of intervention actually in the control group. And then in the retraining group, the brain retraining group, also 2 hours a week for 8 weeks, they were basically taught that graph that I just told you. They were taught how the thoughts and the brain are connected, and they were given a visualization of 100% recovery. I see myself as well and healed. They are taught some breathing, some self-awareness exercises. They're taught body scan meditation. They're given awareness of their internal dialogue. Every time they say, I'm sick, I'm dying, I'm never going to get better, they're given awareness that that's not helping the problem. And then they're given awareness of their limiting beliefs. If they say, I'm never going to get better, that's a limiting belief that needs to be addressed, at least brought to awareness. So these patients are given a different type of therapy that really addresses that emotional center in the brain. So did it do anything, right? These are patients with fibromyalgia who've just been in horrible pain with elevated IL-6 levels for decades. And what they found was that in the treatment group, there was across the board about a 40+% improvement in their pain and in their mood. There was a small improvement in the control group, less than around average about 10%. So much, much better results when you have brain retraining, when the amygdala and insula is retrained. And I would say that mimics my experience with these programs as well. So what is brain retraining? I kind of went through it. The Gupta program is actually the program that was used in that trial, so which is why I feel comfortable recommending it. It's generally a 2 to 6 month program that's of videos online with webinars and some experiential exercises. Again, just retraining the brain towards safety, relaxing the mind body, re-engaging with joy, breathing, meditation, self-coaching, visualization. And I think the most important part is just awareness of negative thought patterns and limiting beliefs. Now, their benefits were about 45%. I have to say, in my clinical experience, if a patient is engaged daily and has buy-in, that actually predicts success. And in my experience, about 80% of patients will come back and say, this is helpful. Something's getting better. I can tell it's helpful. The program itself can be a little bit cheesy because it's like set in the Swiss Alps or something with this music, but that's by intention because very calming during the few minutes that they're watching the video. All right, so that's the central nervous system. That's in the brain. What about the peripheral nervous system? So remember sympathetic versus parasympathetic. We want the parasympathetic rest, digest, and heal mode. And that's mainly governed by the vagus nerve. The vagus nerve innervates the lung, the heart, and the GI system. So what can we do to stimulate, activate the vagus nerve for the rest, digest, and heal properties? Well, there's so many, we can't go through all the data here, but singing, humming, whistling, slow, deep breathing, gargling, meditation, yoga, laughter, massage. There are also vagus nerve exercises that can be really helpful. And I give a link to all these on my website for my patients. And then the last thing I'm going to list here is probiotics. So isn't this interesting? How do probiotics in the gut stimulate the vagus nerve? Well, it turns out that there's a two-way communication between the brain and the gut via the vagus nerve. So here's the gut lining here, okay? And what we see is that from the brain has about 20% vagus efferent fibers. So going from the brain down to the gut. And when the vagus nerve is stimulated, it protects against intestinal permeability and protects against local inflammation. However, if the gut is sick in any way, if there was a COVID-19 infection, if there's not good healthy bacteria there, if there's a lot of inflammation, what happens? That signal goes up through the 80% of afferent vagus nerve fibers up to the brain. And it gives the signal to the brain of, I'm not safe, there's something bad going on in the gut. So a cool study that was just published in 2011 in PNAS showed that when animals were given lactobacillus, a probiotic, so they took a probiotic in their gut, what we found is that probiotic had the ability to shift the signals via the vagus nerve to the brain and regulate emotional behavior. The gut-brain connection is tremendous here, and we have more and more data showing that. So another case for probiotics. So what else is involved in a terrain of safety? How else do we have someone show their subconscious that I am safe? I am safe. So not just the brain retraining program, but this is a huge one that we address in my shared medical appointment: shame, embarrassment, frustration, identity crisis. Like the patient that we started out with in the beginning, who am I if I'm not a life coach? Who am I if I'm not the Energizer Bunny and the epitome of health? This is really something to talk about with patients. Who am I if I can't take care of my 3 kids? I can barely take a shower. So addressing those negative thoughts and concerns will ultimately help them in their healing process. If they've got a religious or spiritual practice absolutely endorsing that. Bring in the angels, bring in God, bring in prayer, whatever they identify with, just a doctor giving them permission as that being part of their healing plan is important. Turning off the news and social media, usually these are negative influences, and just a whole host of other things. Meditations, mantras, I am safe and well, gratitude journals, music, aromatherapy. I think that there's actually a lot in a patient's control if it's framed in terms of benefiting health and being part of healing. Energy practices like Qigong and Tai Chi, and of course, a lot of the healing touch practices as well, acupuncture, chiropractic, Reiki, craniosacral therapy, massage, etc. So what I tell patients is let's learn from the got well, not the still sick. Seek stories of success and recovery. So much on the news is just going on about how long haul COVID is just a disaster and it's just people are still sick and it's so awful and we don't have a cure. Well, actually, there are so many stories of recovery. So I encourage my patients to spend time reading those stories, and I give them a list of places to look on my website as well, so they can feel reassured that they are on the right path and others have done it before them. All right, so there are a lot of drugs that you're going to see mentioned as the evidence unfolds. There is talk of ivermectin, there's talk of fluvoxamine, which is a drug used for OCD, and case reports of patients getting better using those. In my clinical experience, I've not yet seen any patients have miraculous recovery with those two medications. However, that doesn't mean it doesn't work. But I would like to turn our attention to the novel use of low dose naltrexone, LDN. So, naltrexone is an FDA approved medication. It's an opioid receptor blocker often used in heroin overdoses. Well, it turns out that the low dose naltrexone, microdosing naltrexone, has nothing to do with heroin overdosing. In fact, what we see is that when we block the mu opioid receptor in small amounts, it actually increases the natural endorphin production. And integrative doctors have been using this for decades in multiple conditions, and you'll see why in a moment. So when we use low dose naltrexone, it increases the natural endorphins in the body, and that's helpful for the myalgias, aches and pains. So we have used this in fibromyalgia quite a bit. It also blocks the toll-like receptor 4, and these are responsible for a lot of inflammation in the body. So when we block it, we decrease inflammation. And we have research to show that LDN actually blocks TLR4 in the microglia. So remember all those patients with brain fog and neurodegenerative inflammation. This is actually quite helpful for that. Low dose naltrexone also regulates a lot of the immune system cells and stabilizes mast cells, and very importantly, down regulates a type of T cell called the Th17 cell. These are implicated in autoimmune disease. And remember, in coronavirus, we see the gut inflammation triggers leaky gut, which then is responsible for increased autoimmune disease. So down-regulating the Th17 is hugely important here. And autoimmune disease is one of the main reasons that we use low-dose naltrexone. So if a patient wants to try this, there's really no risk. The main downside is insomnia, and that's related to how high the dosage and how fast. So I usually have patients get this from a compounding pharmacy. It's not available at the normal local pharmacy, not often covered by insurance. You get 1.5 milligram capsules and take it at night. And then after 2 to 4 weeks, you can double it to 3 milligrams. After 2 to 4 weeks, triple it to 4.5 milligrams. And that's the target dose, is 4.5 milligrams. I have patients, this is probably the medication where I get the most direct feedback. I like the LDN, it's helping me in some way. Less inflammation, less aches, less brain fog. And like I said, incredibly safe to use. The only time you really cannot use this is if a patient is on opioid medications. So no using LDN, an opioid receptor blocker, if a patient is on active opioid therapy. All right, just a side note, reports about vaccines kind of curing post-COVID syndrome. I don't think I've seen any major studies on this, but there are reports based off of informal surveys. So this is one of the more popular ones that I've seen, 900 patients with post-COVID. And what we see here is that when they were given the vaccine, about 50% of patients felt like they got better. And of these 50%, they felt like there was about a 30% improvement. So not necessarily complete cure, but certainly massive improvement. About 20+% of patients felt like there was no change, and about 20% of patients felt worse. Now, my hypothesis is that the patients who felt worse were probably the patients with out of control mast cell inflammation. Their immune system is already twitchy, and then we gave them something else to inflame it more. So I really try to get patients to have a whole food plant-based diet, good sleep, really control their mast cell activation, and have a positive mindset before they're going to get it. And of note, it looks like Moderna, at least in this study, kind of edges out the others in terms of maximal benefit with the least chance of worsening. But again, this is not a peer-reviewed study. Okay, so we're sort of reminding ourselves that the terrain changed, triggered systems to go haywire, which resulted in a multitude of symptoms. And we took those symptoms, and I hope that you saw over the course of our talk today that we put those symptoms into something we might be able to guide patients with. Mast cell activation, symptoms coming and going, particular GI and chest pain. We have dysautonomia, the heart rate up and down, blood pressure up and down, anxiety. And then the chronic fatigue syndrome, post-exertional malaise, non-refreshing sleep, intermittent fevers. Now, all of these overlap with each other, but these may help guide recommendations when you see a post-COVID patient until we have more data. So if I see someone with symptoms really coming and going, brain retraining, absolutely, but a low histamine diet and antihistamines and mast cell stabilizers through an allergist. Of course, this is going to come on top for everybody, a whole food plant-based diet, conscious movement, good sleep hygiene, brain retraining, and terrain of safety, right? We're trying to shore up the terrain. We're trying to right size those dominoes a little bit. Okay, so everybody gets a healthy diet, sleep routine, brain retraining, but mast cell, they might add on low histamine diet and antihistamine trial. I think most people have a low threshold for trying that. If you have dysautonomia, 110% the brain retraining, but also the salt loading, and then the cardiologist may have some medication. If there's any sign of GI symptoms, intestinal permeability, I'm going to layer on a gluten-free diet and some probiotics. And then for autoimmune, those natural anti-inflammatories, maybe the low dose naltrexone, basically for everyone. And if someone has a chronic fatigue type of symptoms, the post-exertional malaise, we're going to give them the information about self-pacing and the spoon theory and specific supplements for mitochondrial support. If they have loss of smell, we might do the smell therapy with intranasal vitamin A. I don't really have an answer for the loss of taste right now. And then if there's end organ damage, of course, working with the cardiologist and the pulmonologist, but natural anti-inflammatories like omega-3 fatty acids. So this is a ton of stuff for a patient, right? Not everyone needs to do everything. So I kind of introduced this notion of a personalized healing salad bar. So with a salad, the sections are often the same, right? Everyone has a base, everyone has toppings, but the particular ingredients might be different. And I really encourage patients to be empowered to personalize their healing plan, but they need to write out a healing plan. So the base might be the particular diet, whole foods, plant-based, maybe layer on gluten-free or low histamine. The main toppings are going to be the brain retraining, the terrain of healing. The protein might be sort of sleep hygiene, turning off the electronics, maybe melatonin. The dressing might be the conscious movement, knowing if you need to go by the spoon theory or pacing, maybe some qigong or yoga. And then the extras are going to be the select use of supplements and prescriptions. So that needs to come on a strong base. So let's go back to our patient as we wrap up here. Our patient was a super healthy 35-year-old, barely had any COVID symptoms, and her body just completely fell apart. Fortunately, she had a good primary care doctor that did a lot of the tests that I think are reasonable to do: a chemistry panel, blood count, iron studies, thyroid, vitamin D, B12, and zinc, especially for vegetarians. Check for end organ damage, troponin, BNP, D-dimer, ESR, CRP, ANA. A 6-minute walk test in the clinic is super helpful to look for end organ damage as well. And of course, referral to some specialists, so allergist, pulmonary cardiology, and the referral to the COVID SMA for some of this information that I'm sharing today. Brain retraining, maybe with the Gupta program, encouraging that terrain of safety, being conscious of the negative thoughts and how do we shape that. Whole foods, plant-based diet. I advise some salt loading for her because of her blood pressure issues in the morning. Taught her about conscious exercise and the spoon theory. She's a fitness instructor and a life coach, right? So she kept on forcing herself to exercise, almost like to prove herself that she could. And then she got wiped out for a week every time. So giving her permission to actually rest. H1 and H2 blockers twice a day. So loratadine twice a day, Pepcid twice a day with a gluten-free and low histamine diet because she has some mast cell activation symptoms. And then low dose naltrexone. So this is, and then some supplements, absolutely. So this is what it kind of looked like. She didn't want too many supplements. So I advised that with vitamin D, 15 minutes of sunlight. Omega-3, she was going to get through her smash fish, sardines, mackerel, anchovies, and herring. And prebiotic veggie smoothie. I gave her some beetroot powder for nitric oxide, turmeric root, hemp seeds for extra zinc. Blue light blocking glasses. She didn't want to take melatonin, so I said, you got to wear the blue light blocking glasses by sundown. Chamomile tea and magnesium spray at night to go to bed. And then I have two specific supplements that were containing a lot of things all in one. So this one was a particular mitochondrial support supplement. And again, I have the link to that on my website, but these are the B vitamins, some D, she's got some biotin here, some magnesium, some zinc, but really the N-acetylcysteine, acetyl L-carnitine, malic acid, which is important for the Krebs cycle in the mitochondria, alpha lipoic acid, the EGCG, transversal. There's niacin in here as well. So it's really good mitochondrial support supplement. And I also gave her a complex with the luteolin, quercetin, and the coenzyme Q10 in another supplement. So we have this natural mast cell stabilization and mitochondrial support. So her story kind of looked like this. The first week, so she'd been disabled for 10 months. The first week I put her on this plan, improvement in overall symptoms. And she said, I think the low histamine diet and the supplements and medications are really helping. And she started working on her identity crisis. Who am I if I'm not a life coach? Can I just meet my body where I am right now? By the third week, she said, hey, I like the Gupta program. It's helping. Less erratic heart rate, blood pressure, and anxiety. Unfortunately, she was so good, feeling so good, that she overbooked her fourth weekend with hiking and hosted a party and did her taxes. And she had a horrible setback to square one. This is really common with post-COVID patients, these horrible setbacks. And we just learned from each one. So she learned about her spoons and she got up and started the program again. Fifth week, we decided to add on that low dose naltrexone to the original plan. And by the ninth week, she's actually getting ready to return to work part-time. She's keeping up her daily ritual. She's noticing that she has more spoons for energy. She's self-pacing, and it remains to be seen if she's able to continue this. But from what I've seen from other patients, she's on a really good path. One of the questions is, was she just going to get better with the passage of time? I don't know, but she had already been on disability for 10 months. So I have to believe that this treatment plan helped her in some way. And again, it sort of mirrors what I see in other patients. But time is medicine, right? So I only found one study in all of the literature that looked at post-infective illnesses and rate of recovery of chronic fatigue syndrome. And the good news is 91% of post-infective fatigue patients improved within 6 months. To be determined with regards to post-COVID, but I think there is a role for early intervention. So I'm going to leave us with the words of Voltaire. Medicine consists in amusing the patient while nature heals the disease. And I hope that now you can have some more tools in your toolkit to support nature in healing that disease. So again, my living handout for my shared medical appointment is at GinaSerraioccoMD.com/recovery. This is a handout that I give to the patients who attend the shared medical appointment, but you can feel free to look at it and let me know if you have any questions. The EPIC COVID SMA referral is in our system, and the integrative medicine department is here to support you in any way that we can. Thank you.